Hi everyone, we are Tima and our project is on masking and distancing behaviors of UCSD students utilizing ecological momentary assessment. I'm Denisha.
I'm Manar.
I'm Natalie.
I'm Kevin.
And so for the problem we're addressing, as a result of the COVID-19 pandemic, UCSD has started the Return to Learn program, which lists various campus safety requirements that address mask wearing and social distancing. And it's really important that students follow these guidelines in order to keep campus and other students as safe as possible, and so that we can keep our campus open. And also especially because these guidelines are in accordance with the latest San Diego County public health orders, which states to social distance 6 feet apart and to mask at all times unless you're in your own personal space. But there is problems with telling if students are actually following the guidelines because wearing masks and social distancing can be observed in public spaces, and surveys can collect self-reported data, but they both have limitations in determining behavior. So taking these things into account, the problem is that it's hard to tell whether students' behavior in non-public spaces complies with the Return to Learn program's COVID-19 prevention behaviors. Like, for example, if students are hanging out at an indoor location off campus, they might feel less pressure to wear masks because they know that they're in an environment where they're not being publicly observed. And it's hard to gather data about compliance of behavior in these kinds of situations because they are in a private space. So our study wants to tackle these kinds of limitations on being able to observe behavior. Next slide, please. This can be done with ecological momentary assessment, which is EMA for short. So EMA involves repeated sampling of subjects' current behaviors and experiences in real time in a subject's natural environment. And in order to do this, like for our project, it consisted of sending out surveys at random times that are 1 minute long, asking questions about observing behavior and peer masking and peer social distancing in order for us to get that real-time data about the participants' environment and peer behavior. So with using the random time sampling that's associated with EMA, we were able to assess behavior at different times of the day and different days of the week. And we were also able to minimize recall bias and social desirability bias because we're asking participants for information about that specific moment. So using EMA for our project really helped us assess real-time behaviors, which ties into our objectives. Our objectives for this project were to obtain snapshots of student behavior related to social distancing and masking, to assess both on and off campus adherence of the Return to Learn guidelines, to understand temporal variations in adherence, like if there's difference in adherence in times of the day and days of the week, and to examine differences in adherence among different student populations, like undergraduate versus graduate, on versus off campus, sorority and fraternity life, and student athletes.
So for our research, we recruited UCSD students who are currently residing in San Diego County, either on or off campus. It was important to us that we both have on and off campus students represented, so we could potentially see the difference in these behaviors between these two demographics. We recruited students by advertising on student-run Facebook pages and other social media platforms, as you can see with our flyer on the slide here. We visited lots of different lectures. I noticed Dr. Trinidad is here, and he was kind enough to allow us to visit his lecture. We contacted multiple student leaders on both NCAA teams and student leaders in sorority and fraternity life, as well as our fellow classmates in this honors practicum. They were able to reach out to people and their respective organizations and clubs that they're involved in. So we want to give them a big thank you for that. So first we started with our registration survey, where we obtained consent from all of our participants, as well as collecting key demographics, which will be discussed later in the presentation, as well as their phone numbers in order to distribute these EMA surveys. So in order to incentivize our participation in the research, we each time a participant completes an EMA survey via text message, they're entered into a gift card drawing that will occur at the conclusion of our study. So for data collection, in order to distribute our EMAs, we use Qualtrics, which has a feature where we're able to do a two-way SMS text distribution, as you can see on the graphic on the side. The surveys were sent out 3 times a week at random time intervals. And each time a survey was sent, we had an opt-out option. So any of the participants in our survey could withdraw from our study. And for our EMAs, we alternated between surveys asking about peer masking behaviors as well as peer social distancing behaviors.
So we analyzed our data by calculating the masking prevalence, which was the total sum of peers that our respondents reported wearing masks, divided by the total sum of peers that they observed. And then similarly for social distancing, we calculated it by dividing the sum of peer social distancing by the sum of peers observed by our respondents. So we stratified these by lots of variables by whether they were with less than 5 or 5 or more of their peers, and then the demographics that we collected in our registration surveys. So whether they lived on or off campus, gender, year at UCSD, who they were living with, whether they're an athlete, whether they're in sorority fraternity life, and then the temporal variations we discussed. So whether it was a weekday or weekend, and then daytime, which we defined as 6 a.m. to 6 p.m. or nighttime, which was 6 p.m. to 6 a.m. So our response rate was approximately 50%. So for masking survey, as of December 3rd, we've gotten about 54% response rate. And then for the social distancing, a 53% response rate. We've sent the masking survey 7 different times and the social distancing survey 6 different times. So this is a graphic representing our response rates visually. So we started off with 200 participants, but like Natalie mentioned, there was a question on each survey asking if respondents wanted to opt out of the study. So people did choose to opt out throughout the study, and that's why our student study population has dropped to 123 participants as of now. So 38% of our registered participants have opted out since the start of our study. And we've hovered around a 50% response rate, although it is getting a bit lower as of late. So this is a summary of our demographics of our study population. So we have a pretty even split between those living off and on campus, which is a bit skewed towards those living on campus relative to what's occurring at UCSD right now. We have a pretty even split between the different years in terms of undergraduates and very few graduate students, although UCSD's actual full population has fewer first and second years than we do in our study. We also have overrepresented females in our study, and we also overrepresented sorority fraternity life and NCAA athletes. And then it's also important to note that although we experienced dropout during our study demographics are very, very similar for our starting participants and current participants. So that indicates dropout was not differential, which is good because that means that we've limited the bias in our study. So we found that our respondents reported that 45% of their peers were masking overall. So this is just like a general overall dates and overall populations. We also divide them into Halloween and Thanksgiving, and we found that masking was lower on Halloween at 33% and at Thanksgiving with 19%. We found that social distancing generally had a higher adherence with 57%. And then when you break this down to whether they're with less than 5 or 5 or more people, we do see some variation. So we do see higher rates of masking overall when they're with more people, which is good, indicating that people are adhering better when they're in large social groups. However, we did not see this on Halloween, maybe because those people were at parties or get-togethers and didn't wear their masks. And then on Thanksgiving, we saw remarkably low adherence rates to masking. And it's important to note that we did send out the Thanksgiving survey around 3 p.m. So probably dinner time, and people were probably eating and not wearing their masks. So we're assuming that those who were with less than 5 people were probably just having a small get-together with their families. Whereas those who were with more than 5 people might have been, had like a bigger, get-together, might have been more adherent to masking guidelines. And then in general, we found social distancing was not different across whether they were with less than 5 or more than 5 people. And disturbingly, we found that 45% of our respondents reported that 45% of the people that they were with were not from their households. So that's not really that great to hear. So then we calculate statistics based on masking for the different demographics that we collected on. We found that those who live on campus report that more of their peers are wearing masks, so 1.3 times higher prevalence. And then among those who live on campus, they report that prevalence was also higher on campus than off, so 65% versus 29%. So maybe there's more enforcement on campus, or they're just reporting on the general population, and it's not really a reflection of student behavior, like respondent behavior. And then we also found that first, second years especially had higher prevalence rates of wearing masks compared to fourth years. And this could be a reflection of where they're living. So probably first and second years are those living on campus rather than fourth years especially. So it could be a reflection of that on-campus relationship. Then we also find that those who live alone or with family also have higher prevalence of wearing masks, so 1.9 times and 1.2 times higher respectively. So many of these people aren't going out on social gatherings that often, and so they're more likely to wear their masks. And then we find that those who are in sorority fraternity life had a lower rate of masking adherence. So those not in sorority fraternity life were 2.4 times higher prevalence of mask wearing. And then we didn't find a significant difference between athletes and non-athletes for masking. And then we also found that weekday and daytime had higher prevalence of mask wearing as well. So about 1.2 times higher prevalence for each of those. So for social distancing, we found pretty similar results. Again, people who live on campus had a higher prevalence of social distancing. And then we didn't find any significant difference between off or on campus. So whether they were currently off or on campus. And then again, we found that significant difference between first and second years had significantly higher prevalence of social distancing. Again, we might think this is because those are the ones living on campus and adhering more to return to learn guidelines. So interestingly, we found that those living with roommates actually had higher prevalence of social distancing compared to earlier when we just saw those living with family or alone had higher masking prevalence. And then we found those who are in SFL, SFL was not like significantly associated with social distancing prevalence among their peers. And then we found that athletes social distance more actually than non-athletes, so 1.8 times higher prevalence of social distancing. We think this might be due to the stricter adherence might be due to like strict repercussions. For example, like if their coach catches them at a party, they might be kicked off the team or not allowed to compete for this season. And so those kinds of strict enforcement might be leading to higher adherence in athlete populations. And then again, we saw weekday 1.2 times higher prevalence of social distancing, although we didn't see a significant difference between daytime and night.
Okay, so for our limitations and lessons, over the course of the past 10 weeks, we have come across a few limitations and quite a few lessons that we have learned. One of the largest obstacles was our sample size. We began with about 200 participants, and with a smaller participant pool, it can be difficult to understand how generalizable our data is to the UCSD student population. But with any form of self-reporting, there's also risk for response bias, but we hope that was fairly limited by the clarity of our questions, as well as our dedication to participant anonymity. And believe it or not, another limitation is our statistical knowledge. We are not necessarily fully equipped for advanced longitudinal data analysis for repeated measures of our participants. And I think something that everyone is facing right now is a limitation, having everything being conducted entirely online. And this was especially challenging in the very beginning with our recruitment process. But in terms of the things that we have learned, for starters, sometimes the more simple and concise the surveys are, will actually lead to better results. And in the beginning, we wanted to look at many different variables, but later realized that if we focused our attention on peer masking and social distancing behaviors, it would actually increase the strength of our data. And this is also incredibly important to have both quick and user-friendly surveys to increase the probability of retaining our participant adherence to our survey. And lastly, even though EMA limits recall bias and can be completed in less than a minute, there will always be some form of dropout, and that's common with all surveys. So it's important not to get discouraged when conducting surveys. And in the end, we actually had a pretty high response rate to our survey, and we had some pretty significant data coming in. So that was definitely reassuring. And our first recommendation is to increase data collection on mask and social distancing adherence as a whole on campus. And this would provide the university with more information regarding specific group behaviors. And in order for this to be successful, we recommend that the university and its researchers partner with student leaders on campus. For example, somebody who is like a president of SFL or an athletics team or other various organizations. And this could help with marketing because students have a lot of influence on peer behaviors. Additionally, because of this, students and peers know exactly what's going on behind the scenes because we're all students ourselves, so we know what kind of behaviors the people around us are partaking in, especially when it comes to masking and social distancing. So using the power of student voices and relationships to our advantage. And another recommendation that we have is to strategically place more Triton Health ambassadors during busy hours and congested areas of campus. For example, in our study, we found that mask adherence was much lower on the weekends. Therefore, if we were to put more THAs out on the weekends, this could potentially improve the adherence rates. And lastly, it is really important that we all work together in keeping our community safe. So if there's an organization or group on campus that continues to participate in high-risk behaviors that could threaten the safety of the rest of campus, it may be necessary for more targeted education and stricter repercussions for certain infractions. But that is all for us today. Thank you for listening.